On this slide and in every vodcast I will make for our dissection labs, I will list the objectives. So for today that will be, for instance, the boundaries of the posterior cervical triangle and its subdivision and contents. And we have a couple of additional features we will have to pay special attention to in this lab. And then down here, which is very important, are the dissector terms, also referred to as bolded terms, bold print terms with structures and features we all have to be aware of and we all have to see and identify and be able to recognize in lab and on pictures. First off, I would recommend we have a look at this picture, which is taken straight from the dissector. This is a cross-section or transverse section through the neck, and there is quite a lot of fascia and viscera that we can see. So if we start with the viscera, there's a fair amount of viscera that won't play a role in today's lab, but later on that has to do with a lot of these muscles that you can see here that are around the vertebral column. Here's your vertebral column, so this is posterior, and this is anterior. And if we then have a look at the fascial layers, you have several layers of fascia. So you see this most outer layer here is actually the superficial layer of deep fascia, and where it splits around muscles, it is then actually called investing fascia. Fascia that splits around muscles invests them. And then you have fascia that is called prevertebral fascia because it goes right in front of the vertebral column and wraps all the way around here. Then you actually have a space which is behind the pharynx, and that is called the retropharyngeal space. And you have fascia that is in front of the trachea, so this will be called pretracheal fascia. And so overall you can see we have a whole lot of fascia, and I always think it kind of looks a little bit like saran wrap that is wrapped around structures to either compartmentalize things, keep things together, and divide parts of the body into different compartments. One thing that I want to point out, although we're not going to be dealing with it today, is this here. This is the carotid sheath, and within it are three important structures for us, and they're going to come back and we're going to see them frequently. So your internal jugular vein is part of this, your common carotid artery, and your vagus nerve. Those are the three components of the carotid sheath. Which is not part of the sheath, which is outside of it but very close by, is your sympathetic trunk. Okay, that just mentioned on a side note. So one of the first steps in today's dissection is going to be to do the skin incisions as described and indicated in the dissector. Be a little careful that you don't cut too deeply. These incisions are just going to be necessary to remove the skin and nothing else, especially not any of the underlying viscera. Okay, so these pictures are from the dissector, and this is a little preview of, for instance, the boundaries of the posterior triangle of the neck. A bit more is coming on the next slide. So, on this slide, we can actually see the platysma muscle, which I have already mentioned, and you can see it's very, very thin. And this is just copied from the dissector, so when you examine the muscle, you will see how delicate it is, and as I mentioned, it's a muscle of facial expression, and the lower part of the posterior triangle will be covered by it, and you can see it passes superficial to this bone, which is the clavicle, and it attaches to the superficial fascia of the deltoid and pectoral regions. And superiorly, it will attach to the mandible and the skin of the cheek and the angle of the mouth, and also this muscle around the mouth, which is called the orbicularis oris. As a muscle of facial expression, it is innervated by the facial nerve. Okay? So, once you've identified this, you have to be really careful and carefully identify it, because you will have several nerves, like the supraclavicular nerves and transverse cervical nerve, and some more nerves of the cervical plexus. And they're in contact with this muscle, so be careful. You will stick a probe underneath the inferior border and carefully wedge it up, or maybe use the scissor spreading technique. That might work best. When reflecting the platysma muscle, you will actually have to use sharp dissection. So you're going to have to use your scalpel, but be careful. And when you use it, try and use a new blade, and with that you can remove the vessels and nerves from its deep surface so that you can then reflect it upward or superiorly. But if you do not take care that you use sharp dissection, you might actually accidentally reflect all of the interesting structures that are attached to its deep surface. So on this picture you can see the posterior triangle, and you can see the borders. Anterior, the sternocleidomastoid, or the posterior border here. You have the anterior border of the trapezius posteriorly. Inferiorly, you'll have the middle third of the clavicle. The roof towards us is going to be the superficial layer of the deep cervical fascia. And the floor, or the deep, is the muscles of the neck, which are covered by prevertebral fascia. So after your platysma is reflected, you should be able to identify some structures deep to it. This is directly from the dissector. Find your external jugular vein right here. And you should also be able to find branches that merge and lead into it or form it. So your retromandibular vein, your facial vein, and your posterior auricular vein behind the ear. Posterior auricular kind of makes sense. And note that the EJV will cross the anterior surface of the sternocleidomastoid, and this point is actually called the nerve point of the neck, and this is where the branches of the cervical plexus come out. So you'll have, for instance, your lesser occipital, great auricular, transverse cervical that crosses the anterior surface of the SCM, and then you have several branches of your supraclavicular nerves. And another nerve which is really important, and it's rather easy to find, which would be this one, because you should be able to see it going into the sternocleidomastoid, which is innervates, and it also innervates the trapezius, and this is the accessory nerve, or the spinal accessory nerve. I use a mnemonic device to remember these nerves, all of these actually counterclockwise. You start on G as in great auricular nerve, G for great auricular, L for lesser occipital nerve, A for accessory nerve, S for supraclavicular nerves, and T for transverse cervical nerve. Yeah, it spells glast. That doesn't make a lot of sense. It's like glass, just add a T. For me, it worked pretty well. So G, L, A, S, T. So if it helps, just go ahead and use it. This is a image from gross anatomy, a cadaveric picture from McMinn's atlas. Your dissection might look similar to this. After a while, here's your cut edge of the platysma muscle, and it's actually been not reflected but been cut off. But you have several branches here. You have the great auricular nerve right here, the external jugular vein. Here's your common facial vein. Then you have here a little bit of your transverse cervical nerve. You can see how it's actually traveling right across the surface of the sternocleidomastoid. And you may have a communicating vein as well. And here are a few additional muscles that we're going to be dealing with when we start talking about the anterior triangles of the neck. So if we now do a tiny little mini review, just replace the platysma again to where you got it from, fold it back down, so review that, and you might actually note that some of the viscera that you've been studying here, you look on the underside of it or look deep to it, and you should note that deep to it you'll have your external jugular vein, and the cutaneous nerves are all in superficial fascia, but the spinal accessory nerve is deep to this region, and it's in deep cervical fascia. So this is just a pretty crude illustration from the dissector, but it's perfectly okay to use this to review the branches of the cervical plexus and your accessory nerve and these veins. So this slide here I've included so that we can quiz ourselves a little bit. I hope that actually the virtual laser pointer shows up on your screens if you go into presenter mode, and I also hope that the animations will actually show up. So I'm going to try to add the first few lines. There should be the first line showing to this structure. What is that? It is an important part because it is the anterior boundary of the posterior triangle. So this is going to be your sternocleidomastoid, and then next we will have this structure down here, which is the clavicle, or the middle third of the clavicle. Okay, so then down here, this region It is fascia, but what kind of fascia is it? It'll be the prevertebral layer of deep cervical fascia, because it's not superficial fascia. So this is the fascia that the this structure here will run in. I'll show you that in a moment. You probably already know what it is. This here is the cut surface. Let me point to it. This here is the cut surface of the platysma muscle. Then this structure here, what could it be? It crosses across the sternocleidomastoid, and that will be the external jugular vein. And then this here, I can finally tell you, this is now the spinal accessory nerve. See, it comes out from underneath the sternocleidomastoid and continues its way down to the trapezius. So this muscle here, although not labeled, is the trapezius. Well, actually it's labeled right here. And then we have a couple of nerves from our cervical plexus. See, this nerve comes out of the nerve point but goes back here to the occipital region, so that'll be the lesser occipital nerve. And you have another nerve here that travels here kind of towards the ear, and the ear is also called auricle, so that's a great nerve, so that'll be the great auricular nerve. Then you have this nerve that actually goes transversely across the anterior surface of the sternocleidomastoid. So, well, let's just call it the transverse cervical nerve. And then we have these nerves here that kind of go superficial to the clavicle, yeah. And so if they do that, we'll call them the supraclavicular nerves. How's that? Okay. So, and these here are all branches of the cervical plexus, except for this here, cranial nerve number 11, the spinal accessory nerve. That is a cranial nerve. Okay? But all the others are branches of the cervical plexus. So, here on this slide, I'm just including some links for you. It's always useful to have a look at some videos, and for more information, you can visit these URLs. I really like the ones from the University of Michigan. They often have very nice dissection videos in there. And this sequence of videos also includes some osteology, or here from the University of Wisconsin. This covers a little more material than we need for today, but it's also a nice dissection, and things always look different in the real specimen, in the cadaveric specimen, than in pictures. Not everything's color-coded as nicely as in Netter's or Grant's or ECA, as in all these books. So any of these resources I would encourage you to use. Thank you.